Today's question is about kidney diseases. Usually, doctors tell you to avoid bananas because they're rich in potassium, and they tell you to avoid green leafy vegetables and leach all the vegetables and also avoid proteins, but then they often allow milk and so on. The diets which doctors recommend for kidney disease, how can we do that when we are following SHARAN's lifestyle? Because SHARAN recommends something totally different. And that's true. We start our day with green smoothies, which contains bananas and green leaves. How can it work for someone with kidney disease? Here's the thing we have to understand. Every case of kidney disease which is following doctor's recommendations, do they ever get better? No. Over a period of time, they increase medications and then eventually go in for dialysis. And then eventually, because dialysis destroys kidneys, they go in for a transplant. This is not wise. We have to think about it a different way. What are the causes of kidney disease? And truly, the causes of kidney disease are high blood pressure and diabetes. So, if we want to get rid of kidney disease, we have to get rid of high blood pressure and diabetes. And the causes of high blood pressure and diabetes are similar: excess fat, lack of fiber, lack of vitamin D causes diabetes, lack of vitamin B12 causes high blood pressure, tea, coffee, colas raise blood sugar and blood pressure. So these should be eliminated. And I know that this is something that most people avoid doing. Nobody wants to leave their tea and coffee. But here's the thing, if you start on green smoothies, it's really easy to leave tea and coffee. And the best thing about green smoothies is that they contain greens and bananas, which contain potassium. But you'll never get excess potassium because of the fiber. Now, potassium helps lower blood pressure, and lower blood pressure decreases kidney disease. So, remember one thing, you can't solve a problem by doing the same thing that caused it. So, if you've been following doctor's advice and not getting results, try SHARAN's advice. Whole food, plant-based, as well as organic. Our liver breaks down all the things that go into our body and our kidneys excrete it. If you have more chemicals in the form of even medicines or non-organic foods, even there are other ways in which we absorb chemicals. We absorb chemicals not just through our mouth, but through our skin. All those soaps, shampoos, perfumes, deodorants, all these things that we're using on our body, lotions, potions, and hand sanitizers, are harmful to the kidneys because they're absorbed and have to be excreted by the kidneys. Also, what we breathe in, all those agarbattis and scented candles and air fresheners and phenyls and window cleaners and toilet cleaners and detergents and fabric softeners, all those smelly things are absorbed through our lungs and have to be excreted through our kidneys. So make it really easy for your kidneys. Increase the fiber through whole plant-based diet. Don't leach anything to get more nutrients. Nutrients are the spare parts for healing. And make sure that you're avoiding the things that cause high blood pressure and diabetes, so that these reduce, so that you're able to reduce the medicines. Now, the truth is, you can't do this alone. If you have kidney disease, you're really advised to take a consultation with one of our doctors so that they help you in a step-by-step manner, reducing medicines and reducing high blood pressure and diabetes so that your kidney disease automatically reduces. One more thing about kidney disease. When we have kidney disease, we have high blood urea nitrogen, high urea, uric acid, and creatinine. And all these are products of protein breakdown. And therefore, it's really important to minimize the protein when you have kidney disease. Now, where are the proteins coming from? Obviously, the animal products, these should not be had at all. But what about the plant products, the beans? These also should be kept to a minimum. Now, the best thing about whole food plant based diet is that it contains fiber. You won't eat too much if you have high fiber diet. So, here's what we should do. Always have dals which are whole. Instead of dals, if you can have sprouts, they are even better. And keep all the beans, sprouts to a minimum. Have a little, not too much, more fruits and vegetables to heal kidney disorders. Try it and see what happens.